Good morning, fellow students. My name is Catherine Tello, and I will be teaching you on how to conduct a physical exam with an animal. Today we'll be using a stuffed animal since I couldn't bring in a live one. According to our vet technician textbook, they always say that a physical exam is one of the most important things that we can do. Since the animal really can't converse with us, we really need to let them know. We need to figure out in detail if there's anything wrong so we could diagnose it and treat it beforehand. According to DMV Harvey with the Shelter Medicine Program, you always want to conduct the physical exam in the same orderly fashion that you've done all your other ones. You want to do this so you don't miss anything. So let me go ahead and start with the physical exam. The most important things to start off with is always the weight, temperature, heart rate, and the respiration rate. So let's go ahead and weigh this dog. You're going to take it to the scale. You're going to zero out the scale until it's 0, and then let the animal be upon it. You want to make sure that all their 4 limbs are on there so you can get a correct weight. Once it tells you the weight, then you're going to take the animal and put it back into the clinic room. You're going to place them on top of the table and remember what the weight was and document it. After you're going to weigh them, we're going to go ahead and take its temperature, You're going to use a thermometer, you're going to press the button, wait till it zeros, and then you're going to place it right in their rectum and let it stay there until the thermometer beeps. This doesn't really hurt the animal, so they might be a little uncomfortable with it and you might have to have help restraining the animal for a couple of seconds until it goes. Once it beeps, you're going to document that also on your sheet. Then we're going to use the stethoscope and we're going to check the heart rate and also the respiration rate. You want to put the ear nuts going forward like this inside your ear. Then you're going to turn the knob and make sure that you can hear. We're going to start off with the heart rate today. You're going to always check the heart rate on the left side since that's where it's located. It's going to be right under their left arm, front arm, and you're just going to place it right there and you're going to start hearing the beat. For about 15 seconds, count how many heartbeats you can get, and then you're going to multiply it by 4. Since this stuffed animal clearly doesn't have a heartbeat, we're just going to go ahead and move on to the respiration. You're going to, for the respiration, there's 2 lungs, so you're going to want to check in 4 spots. One in the upper part, and one in the lower part, and then located on the right side, one in the lower part, and then to the upper part. After you can hear that there's no swishing or a pneumonia kind of sounding breathing, you want to check how many respirations they do. So you're going to sit there and listen to how many times they inhale and exhale, and that's going to count as 1. You're going to do that for 15 seconds, and then multiply that by 4 to equal a minute. So after that, we are going to start with the nose today. You always want to make sure on a dog if the nose is wet, if it's too dry, if anything's going on. You want to check if there's discharge. So this dog looks like it's normal. Then you're going to move to the mouth. Like Carmel says, you always want to go from the head to the toe. And you're just going to check the mouth, see if there's any dental issues, any teeth loose, any sores, gingivitis. You can also recommend a dental if it's needed. After going from the mouth, we're going to go ahead and check the eyes. We're going to check for discharge on the eyes, the eyelids, look and see if there's any corneal scratches. But then you're going to have to use an instrument called the ophthalmoscope. And you're going to put it in like that and twist it until it locks. It turns on with this red button, and we're going to turn it on now. You use this scroll right here for the depth. So you're going to start at the cornea and then go back to the lens and then to the retina. Since this dog is really a stuffed animal, I can't really go through, but I'll go through the process for you. And we are checking the cornea now, then the lens, and the retina. After that, I'm going to go ahead and move to the ears. For the ears, you're going to use an otoscope. You're going to turn this on, the light's already on, put that on, and then put the ear plug in for it. Now you're going to lift the ear. You might have to have help restraining the animal for this. And you're going to put this inside the ear and point it down towards the drum. You're going to be looking through the canal. And you're going to check if you see any debris, wax buildup, inflammation inside the canal, if the eardrum has ruptured. Most of the time in animals they have ear mites, which is kind of like a black debris located all around it. And if you see that, you're going to have to document that and treat it. So now that we've kind of checked the face, let me just go along and check the neck, around the head, and see if there's anything going on. We're going to now have to go along the body, check the skin, the hair, if it's dull, if there's any lumps, bumps, rashes, sores along the entire body on the integument. After that, we're going to go under and check under the belly and see if there's anything we can feel. You might also want to palpate the bladder and the kidneys to see if you could feel any odd lumps or anything like that. You can also find fatty tumors along under here. That's where they normally come. And fatty tumors are benign tumors, but some can be cancerous, so you want to make sure that you can document where they're at. After moving from the body, you want to start going down to the feet. You want to palpate the paws and check under the paws to see if there's any sores under there. You want to check the digits to see if there's anything in between, and the nails to see if there's an ingrown nail. You want to do this with all 4 paws, and once that looks okay, let's move on to the back part. We're going to now look at the tail, and I'm going to look around it and the base of it and see if there's anything going on. Then you will check the anal glands and see perhaps if they've been ruptured or you need to express them. After that, the next and last part is you're going to check the genital area. If it's a boy, you're going to check the penis and pull the slit back and to make sure that there's no discharge coming from the tip of the penis. You will also want to palpate the testes and make sure that there's 2, because sometimes in the animals they could be crypt orchid where one is actually hidden inside their body. If it's a girl, you want to check her vulva and see if there's any discharge. Discharge can mean a UTI, a urinary tract infection, or it can mean that they're in heat, their menstrual period. Once you've completed the entire physical exam, you want to document again any abnormalities that you see, and then you're just going to go ahead and put the animal back on the floor with the client and let the doctor know exactly what's going on, and he will come in and conduct a further physical exam. So thank you all so much today for watching me. If you have any questions, let me know if I can help you out. I have been teaching you how to conduct a physical exam on an animal, and again, you can use this in the same orderly fashion for any horse, cat, dog, and any kind of animal that you bring into the clinic. Thank you so much, and you'll have a wonderful day.